Very good morning to all of you. I would like to compliment and congratulate Dr. Sanjay, Dr. Pawan, and the entire team of Food Secure for organizing this very innovative Podocon 2023. The Podocon is always a very innovative, starting from 2019. This year the focus is mainly on the technologies and the various therapeutics for the diabetic foot management. My topic of presentations will be focusing on the novel laser medical shoe on the neuropathic pain as well as the plantar pressure profile in type 2 diabetes with the peripheral neuropathy. As all of us know, the magnitude of the diabetes problems across the globe and even especially in India, it's significantly increasing. And by 2045, almost 125 millions will be diagnosed with the type 2 diabetes in Indian populations. As highlighted during the inauguration by the chief guest, not only the managing the diabetes, the complications associated with the diabetes is a major challenge in the clinical practice. As all of us know, the diabetes can lead to complications like microvascular and the macrovascular complications. Among the microvascular complication, the diabetic peripheral neuropathy is one of the major challenging complications in the clinical practice. Almost the DPN is prevalent from 30.2 to 49% for the patients with type 2 diabetes mellitus, and presently even with the 1 year and above of type 2 diabetes mellitus, if the glycemic control is not maintained properly, even they can start developing the microvascular complications. The peripheral neuropathy, 1 in 6% people with type 2 diabetes mellitus or the peripheral neuropathy can lead to the foot ulcer. And most importantly, the 40 to 50% of the people will develop the painful peripheral neuropathy. This is a major challenge in the clinical practice, and every 20 to 30 seconds people are losing their limb mainly because of the diabetic foot. So why exactly it's the innovation is needed? Looking at the magnitude of the problem, we just identified a non-pharmacological agent which is focusing on the pain and the focusing on the microcirculations. As all of us know, the peripheral neuropathy can lead to an increase in the pain, decrease in the microcirculation, thereby which leads to the decreased functions as well as the quality of life. Most importantly, in the type 2 diabetes or with the microvascular complications, the major challenge is the altered microcirculation. Therefore, this leads to a chronic problems or the issues in the patients. There are many pharmacological agents which are addressing the neuropathic pain. However, the non-pharmacological agent like the laser is found to be effective in improving the microcirculations and the peripheral neuropathic pain. So, why the innovation is required? Presently, if you look at in the clinical practice, we have a different probe or the scanning laser where patients have to lie down either in supine or prone positions if you need to target the foot, both the plantar and the dorsal aspect. Considering, and also they have other comorbidities, severe patients may be having the obesity and other neurodegenerative problems. Sometimes lying the prone position itself is a challenge to them. Therefore, considering this, we just initiated an innovation which focusing on the in the sitting positions itself. I will come to that little later. The objective of the innovation or developing the medical laser is mainly to focus on the management of the diabetic foot, specifically focusing on the neuropathic pain, plantar pressure as well as the neuropathic parameters. So, this is the laser shoe technology we developed as one of the important medical innovation, which consisting of it looks like a shoe, therefore we call it as a laser shoe also. It has a combinations of the two different wavelength focusing both on the microcirculation as well as the pain. These are the various specific the lasers as well as the light emitting diodes have been used in the laser shoe technology. So, once we develop this prototype, the prototype have been validated technically as well as the clinically. Then to establish this clinical efficacy, we conducted a clinical trial 60 participants with the type 2 diabetes with the peripheral neuropathies have been included in the study. The study have been conducted as per the ethical guidelines after obtaining the Institutional Ethics Committee as well as the Clinical Trial Registry of India registration. The study was initiated. The participants with the age group of 30 to 75 of both the gender, loss of protective sensation and also an increase in the vibratory sensations which confirms the neuropathy have been included in the study. If they have any other complications like ulceration, any other rest limb pain, basically focusing on the ischemic pain, have been excluded from the study. This is the study procedures we followed. So before we start the study, the detailed diabetic foot evaluations have been conducted, not just focusing only on the neuropathy. All the detailed diabetic foot assessment focusing on the neuropathy, vascular, musculoskeletal and the biomechanical assessment have been performed. This is the procedure for assessing the protective sensation of the patient. Normally we use the 10 gram of monofilament basically to identify the protective sensation. According to the new guidelines, even if there is a loss of 1 point in the foot region, there is a loss of protective sensation, we consider them as a neuropathy. In addition, we also did the vibratory sensation assessment. This helps, it is a semi-quantitative method where the patients as well as at the same time we can able to know the amount of change in the vibratory sensation. Anybody with the less than 20 volt is considered to be clinically we consider as a normal. Anybody with the 20 to 24.9 is considered as the mild neuropathy, moderate neuropathy as well as the severe neuropathy. If more than 39 is considered to be severe neuropathy. We also performed the ankle brachial index as well as the toe brachial index mainly to assess the circulations to the foot. Especially the toe brachial index helps in understanding the digital or the toe circulations, and normally which is one of the important predictor of the change in the microcirculations in the foot. Anything less than 0.7 of the toe brachial index is considered to be an altered microcirculations of the foot. In addition to that, the plantar pressure analysis also play an important role in the clinical practice. Basically to know, because of the pain and the loss of protective sensation, how much is the change in the plantar pressure distributions during standing as well as the ambulation. A detailed analysis of the plantar pressure is also done before we start administering the laser therapy. After that, in a sitting position, the 10 days of treatment have been given. 10 minutes per sessions have been included. Basically the patient needs to sit and then the foot will be inserted in the laser shoe. The advantage of this is at the same time we can able to irradiate both the plantar and the dorsal aspect of the foot. This is the demographic and the clinical characteristics of the patients. Mean age of 52, BMI of 24.33, duration of the diabetes on average 7 years. The duration of the neuropathy was 3 years and above. This is the biochemical parameter. The patients are also, the parameters indicates that the patients are uncontrolled diabetes mellitus. And all these patients were on, depends upon the physician prescriptions either on the oral hypoglycemic agent or insulin. We did the neuropathic pain assessment pre and post treatment. This has been done baseline, 10th day and after 1 month of the treatment. What we observed is both the component of the MNSA of A and the B component, there is a significant reductions following the laser therapy. Most importantly, all these parameters like the neuropathic and the vascular parameters have been conducted on baseline, 10th day and after 1 month of follow-up. What we observed is with the irradiation of the 10 days of laser, even after 1 month, we observed a significant changes in the neuropathic and the vascular parameters in terms of the monofilament, in terms of the vibratory sensation, ankle brachial index as well as the ankle reflexes. In addition to that, the mean plantar pressure analysis was done pre and the post. The mean assessment was especially for the plantar pressure analysis we did on the pre as well as the 1 month follow-up. Initially, if you look at all the areas, the region of interest, what we selected in the foot area, there was a significant increase in the plantar pressure. As the pain decreases and as the improvement in the neuropathic parameter, after 1 month, we observed that this plantar pressure changes have been drastically reduced. This is one of the preventive strategies to reduce the risk of loading on an abnormal area, especially on the base of the second metatarsal head. Thereby, we can prevent the further onset of the callus or the ulcers in this population. So, what exactly the mechanism, possible mechanisms? We, in addition to the clinical parameters, we also taken the neuropathic markers. The annulase and the neuropathic specific markers have been taken in this. It is still it is an ongoing study. I have not presented in this presentation. And based on our interim or the preliminary analysis, it's also observed that there is a this laser works even at the biochemical level also. The result analysis showed significant reductions in the pain, and also we have observed significant reductions in the vibratory sensation as well as mean reductions in the maximum plantar pressure. So, globally the neuropathic experts developed recommendations in treating the DPN with non-pharmacological intervention. The novel laser is a newer technology, especially in the diabetic foot. How exactly it works is the photobiomodulation helps to improve the microcirculation by increasing the release of nitric oxide, increases the ATP production, thereby increasing the cell metabolism. In addition, it also leads to the restoration of the peripheral nerve function by inhibition of the aldose reductase, leading to the sparing of the NADPH as well as which may then precipitate in synthesis of the nitric oxide, thereby relieving the nerves of their hypoxemic state. Another important observations also would like to share here is this all the part of the ongoing study. What we also conducted a nerve conduction study in the mild and the moderate neuropathy patients. Even we are observing a structural improvement in the neuropathic also. This may be one of the important challenging question, because majority of the literature says that once neuropathy is develops, it is irreversible. Maybe this is a one challenging questions where we have been discussing with Dr. Pradeep and Dr. Pavan. Maybe in the near future we should be able to explore that any agents or the therapeutic agent which helps in improving the microcirculation, whether it also helps in improving the neural function, that needs to be explored further with the larger trial. Another possible mechanism, as I mentioned, is improving the microcirculation and normal functioning of the muscle and the skin. As the pain comes down, the mobility improves, especially the intrinsic muscle movements, and the muscle's flexibility will improve. That helps in reorganizing or the redistributions of the plantar pressure also. So, patient reported self, this is another important observation. As all these 60 patients whom they reported that especially the early morning pain have been drastically reduced in these patients. Thereby, they were able to perform their activity or the function better, and even in their quality of life is also significantly improved in these patients. And also part of this trial, we have a long-term follow-up, almost 12 months we have been following them, and few of the patients, I can say about 23% of among the 60 patients have been completely weaned off from the neuropathic pain medications, especially the pregabalins and or the antidepressant agent, and they did not even the recurrence of the pain is not reported in these patients. Thereby, according to the patient's reported outcome measure for a longer duration, we observed that significant reductions in the intensity of the pain, improved mobility and the quality of life, moderate and the mild neuropathy pain have been drastically reduced in these patients. High risk neuropathy provided laser again after 6 months, because they need one round of another sessions is essential. 33% of the patients have been weaned from the neuropathic medications. So, what is the opportunity of this novel innovation? Considering the magnitude of the problems, especially in Indian population, neuropathic pain is a major challenge. There is a need for the comprehensive care for neuropathic pain management. Therefore, this non-pharmacological or the non-invasive technique will have a lot of potential and the opportunities in the healthcare system to treat the neuropathic pain and thereby reducing the burden of the neuropathic pain in the society. Conclusion, in present study, laser shoe is found to be effective on pain, vibration perception threshold, reducing the maximum plantar pressure in type 2 diabetic neuropathy. This is also we are doing the trial in the different grades of ulcer. We observed on 27th day there is a drastic complete closure of the diabetic foot ulcer also. So, these are the various measurable outcome as part of these things. We have received many awards. The recent one is called the Niti Aayog Best Medical Product Award for the 2022. We also, this technology is developed as part of the funding by the Department of Science and Technology. Recently, we have officially launched this technology in collaborations with the Department of Science and Technology head, and so social impact as well as this is another case treated with that. The complete 6 week there is a complete closure of this. This is the outcome of this. We have also submitted for the patent. The patent is almost getting approved by the Indian government shortly, and also we have a copyright, and thank you all for this opportunity. And also in 2023 I have received the Best Medical Research Award by the Chalaram Diabetic Hospital and the Indian Diabetic Federation conference in Pune, as they have considered this as one of the best medical innovations in the diabetic foot management. Thank you all.